There are few priorities or interests of mine. One of them is the minimally invasive surgery. I was doing the minimally invasive lung surgery for a while. We call it VATS, video-assisted thoracic surgery, where you make a keyhole surgery, and when you can remove big part of entire lungs through the small incision. I concentrate now on learning and getting in depth with doing the minimally invasive cardiac surgery. Another big interest of mine is doing a major operation on the aorta, which is the largest artery in our body that comes out of the heart, and there are some conditions that are life-threatening, like aortic dissection, when the blood separates the layers of the aortic wall, and the surgery must be done very urgently, or so-called aortic aneurysm, when the aorta becomes very large and needs to be replaced by a special graft. And I've got an interest in doing major surgery on aorta. And recently I started doing robotic surgery. I've done several cases, and it's a stepwise process where you need to do a number of cases for certification. I did initially a few operations on the masses in the chest, neck mass, and successfully removed them. And I have done some surgery on the lungs using the robot Vinci excise system. Very exciting. And that's where a lot of future, as it stands, will be in surgery, and I certainly concentrate on this aspect of surgery. And another particular interest of mine is the surgery for atrial fibrillation or irregular heartbeats, and I'm quite passionate about provision of this surgery when I operate on the hearts, particularly the complex operations, to try to return people into their regular heart rhythm, sinus rhythm, and that's very important for the quality and quantity of life. And the very, very last thing that I have done a couple of these operations is the aortic root or aortic annulus enlargement, and that's the surgery that was really invented by one of the American surgeons reasonably recently, and it gives a chance to patients when the aortic valve doesn't work well to replace it with a big biological. It's very important that the bioprosthetic valve is fairly large, so they've got no limitations in their life. So that is my latest interest.